Well, thank you very much. And I think we have 15 minutes left before we have to move to the next session. I think we heard quite a number of ideas about increasing the effectiveness in the sector, bringing in other actors and so on. But if I really purely limit myself to the financial issue, because there were a lot of comments on other issues also very relevant, but that perhaps came already, were on the agenda of previous sessions, but purely on the financial issue. And we have 15 minutes left. And again, I think it would be very interesting to focus really on how are we going to get more funds, or, as was said, how are the funds being spent, being used well? Because I think that was a very relevant comment. I heard somebody talking about innovative resources. I heard somebody talk about hedge funds. The used well, that was important. I think also the dimension of, in terms of convincing people that stressing it's not investing in nutrition, it's investing in many other things at the same time in order to increase the acceptability or the attractiveness of investing in that particular, on that particular issue. Break down the silos was also mentioned in that respect. So quite a number of interesting ideas, but perhaps I could ask you, first of all, anybody can in a tweet style react to whatever other people have said, but it would perhaps also be interesting in the second round where the clock will be much stricter. If you have any comments if you're standing in an elevator with a Minister of Finance or with the manager of an institutional investor, what could you tell them, this man or this woman, in terms of why invest more in this sector in order to achieve SDG2. So not other issues, purely the financial dimension. What kind of innovative instrument could you kind of mention to entice somebody to say, hey, yes, actually, why not? Yeah, that might be a good idea. Rob, I see you're having ideas.
Yeah, that's a tough one.
You have 2 minutes, so.
Oh, golly. So I think, frankly, I think the more we can figure out how to leverage private investment, and I would certainly include it in the areas we've talked about, and also water and sanitation, the more we can also convince public high-level decision makers to invest. So figuring out a connection there, and I think that can be at all levels. It can be at a very high macro level, at the level of a national or regional investment of some kind or policy, but it can also be right on the ground. And as I said, one of the challenges that I think about is what are the public investments that we need to open up the opportunities for the private investment to step in and really enable poorer people to tap into this dynamic food system that can generate benefits for all, but especially the poor, be they in rural or urban areas. So I don't think I've answered your question very well, Case, but the other point I would come back to is, well, I guess one of my last points is, I'd want to talk about accountability. What can we deliver? And I think being able to have compelling metrics still matters. The AIDS group, the HIV, PEPFAR, they said what they were going to achieve. Now, health has always had an edge on us in agriculture in doing that. But if we can have compelling metrics, that will also help drive investment, and perhaps also from the private sector. Let's not leave their goodwill and higher interest out of this.
Yeah. I think, George, you mentioned that you have targets, right? Very specific targets in terms of what you want to achieve. But I think what you said one word. I don't think anybody has used that word so far, leverage. And I think that is absolutely essential. I don't know if you used it, but I think that is indeed, because there's so much we could do for the public sector, and we really need to leverage with the private sector. I think that's a very important thought. So that's, in the elevator, I think, quite a good concept. Anybody else? So, yes, sorry, shall we go along the line? Shall we? Yes, please. Marcus.
Okay, thank you. No, from the 4 points I put productivity, vertical coordination, cold chains, and trade. I think that productivity and open trade is already addressed. Where I think we should invest is in cold chains, for sure, because if we don't have stable electricity in the countries, It's very difficult to have cold chains. Most of the countries that have 20, 30% of the households with cold chains that I mentioned, India, Indonesia, they don't have stable electricity. So this is extremely important as one of the leverage to have refrigerators and to have cold chains and to have more meat consumption and also fruits and vegetables. The second point about the contracts, the vertical coordination between all the steps of the food chain, I think we need really to bring the food processors and the food distributors to the table. They are not in the table here. They are not in the table in most of the places in terms of health and nutrition. But there are other initiatives where they are putting money today. For example, you have the Global Food Safety Initiative, where there is the big distributors and the big companies producing food that are meeting to change the standards, to have a meta standard in terms of the food safety area. So why don't we can have also something like the Global Food Safety and Nutrition Initiative? Mm-hmm. So bringing together food safety and nutritional issues, putting together the food distributors, which I mean, for example, quick service restaurants, small shops, supermarkets, food services, hotels, restaurants, cafeterias, so all the distribution channels together with the food industry to discuss not only food safety, which is already there, but all the nutritional issues. I think that if we put this together, we can improve the private sector funds for this area.
Thank you very much for this very specific proposal. I think you also said we eat more meat. I see some nodding there, which is not exactly supporting. I've lived 5 years in Brazil. I enjoy the meat there. Having said that, in view of other discussions, anyway, that's for the next forum, I guess.
We can have a panel about that.
Yeah. Would you like to? Yes.
Yeah, I would say that investing in nutrition is central to healthy and well-functioning societies, and also for increasing economic productivity. So it should not be separated from income. Then the other opportunities I would also look at is how to invest, to leverage private sector investments. And by investing in smallholder farmers, making sure they have access to capital, both not only for productivity, but also for beyond productivity processing and supply chain and also their livelihoods. Then the other thing also is to create jobs for young people, because then there are opportunities to create jobs for young people through these investments. So when we are targeting the smallholder farmers, make sure that the youth are also included. Then in terms of public-private producer partnerships, I think it will be important to equip the smallholders to negotiate with public and private sectors. Otherwise, they become the weaker link within the chain. So how do we ensure that they have that capacity and they are a respected partner within that chain? That would be very, very important. Otherwise, it's easy to say it's done, but then we need to do a little bit more work with them. Then finally, also ensuring inclusive rural financial services. We know that women and the youth and other poor people in many countries don't have access to finance. So that level of financing at times is not thought about. But then the women can do a lot with very little financing. And that is one way of also linking them to the bigger financial systems. Mm-hmm. So that is also an area that we should not forget in terms of leaving no one behind. Yeah.
I think after the word leveraging, you added access to capital, which is also, of course, quite absolutely central. Adding that to farmers, yes, but young people and women, and I'm glad you also mentioned that dimension, which we all know is also quite important, quite central. Mira, you were also kind of ready to jump.
Sure. So continuing on the leveraging theme, I'll give you a very specific example of an innovative financing facility that I mentioned, which is the Power of Nutrition. The business model of the Power of Nutrition is that every dollar that is committed by the private sector, $1, is matched by a public sector partner. It's DFID in this case, in the room somewhere. So that dollar becomes $2. Then there's $2 the Power of Nutrition brings to partners like the World Bank, and we double it again, at least. So by the time it gets to the country, that $1 is at least $4. Sometimes, in the case of Madagascar, it's $9. So it's a multiplication game, essentially. And the idea is that every dollar contributed by the private sector is multiplied by the time it gets to the country. So that's one on the leveraging side. The second thing is leveraging results is absolutely critical. Speaking to the issue of targets and things, we're all working towards the SDG targets and the World Health Assembly targets. So those are very clear, whether it's stunting reduction or anemia or whatever other targets there may be. But when you provide financing that is premised on results, the finances are released when results are achieved. It's a very different investment model. So in the past, the bank used to do much more what we call investment lending. Now we do much more performance-based investment or P4R or results-based financing, many different names in bankies. But essentially, I think you get the idea. The monies are released when results are achieved, rather than buy 10 vehicles and do 100 capsules of vitamin A. That's not the way monies are invested anymore.
Okay. A question in 1 minute. Do you have your IFC, do you have instruments to insure the private sector against risks of investments in this particular sector? You know, which is another way of making it attractive for the private sector to invest. I'm sure you have.
There are certain instruments. I can't give those to you in 1 minute, but we can talk about those.
Okay.
There are.
But that's another way of leveraging, or okay.
Yes.
Okay.
Buy downs being one of those instruments.
Okay.
Yeah.
Maria, I don't know if you have any.
2 points. One, health insurance. Right now, we are working on health insurance packages through the life cycle, and we're making sure that nutrition services, well, at least nutrition-specific services are part of that package, so that eventually the health insurance system will be paying for these services. So that should take away a lot of load from government. For nutrition sensitive, we think that the investment needed to making existing programs nutrition sensitive is not much. For example, if you have an existing farm-to-market road program, and if you can target areas with high levels of malnutrition first before everybody else, any other place, you don't need much money because that farm-to-market road is there, but you're just putting it in an area where you think it has the potential to produce outcomes. And the only thing that has to be done is coordination between the agriculture sector and the health sector that has the data on malnutrition rates and malnourished families or pregnant women, so that these services can be targeted to these families or to these households together with nutrition-specific ones. So I don't think you need a lot of additional investments for existing nutrition, agriculture programs, for example.
Thank you very much. Hidea, to compensate for the chair, you have the last 2 minutes.
I'm already grown up, so it's fit for me. Okay. So 2 points. The first one is the same as the Mira's just said. Public sector's role is to provide the seed money to attract private sectors. Private sectors cannot take a risk from the scratch. So providing a seed money from the public sector is the key. Secondly, Japan has an experience that provided loan to a certain developing country, and a developing country used it for vaccination. And if the rate of the disease decreased, then the Gates Foundation gave back money to Japan. So at no cost, the developing country could reduce the rate of disease. That's called loan conversion.
That's the buy downs.
Right, right. So this is the second point I'd like to mention. Thank you.
Thank you. Okay, well, in the 50 seconds left, I will certainly not try to summarize what we've had. I think we've had quite an interesting discussion. about many things, but also definitely about the financial part, which was our kind of mandate. And seed money, again, that's a very useful addition to our discussion. De-risking, you were mentioning, leveraging and so on. So I guess these are all concepts we can take with us when we make the little summary of this particular session. So I guess I would like to leave it at that and not summarize, because that's, I guess it was a bit too going into all kinds of directions. But I hope, in any case, that the audience will take away a few of the ideas, and hopefully this will be useful in what we're all working very hard for, which is achieving SDG 2 and the other ones. So thank you very much, and especially thank you for all the panelists. Thank you.